This is your training on HLA typing for Bone Marrow, City of Hope. Please make sure at the end of the presentation that you are signing the attestation form that you have watched this video in its entirety. Okay, let's get started. So for City of Hope, HLA laboratory blood collection, there have been 3 separate incidents from 3 different service areas where an HLA antibody screen order was marked on the order requisition form, which requires a red top tube. And only ACD yellow tubes were sent. Please make sure that you are drawing the correct tubes. All orders required a redraw. Additionally, there was a separate incident that was reported related to a laboratory that documented the exact same collection date and time on both the donor and the recipient, and it was collected by the same phlebotomist. If you are drawing the recipient, please make sure that somebody else is drawing the donor. Please do not draw both the recipient and the donor. Let another phlebotomist draw the other one. Okay, so the requisition form from City of Hope. All required fields must be completed. The yellow areas are to be completed by the coordinator or the doctor, and the purple area is where you will be putting the sample information, the name, the date of birth, collection date and time, the number of tubes that were drawn, who collected it, and confirmed that the name and date of birth were on the tubes, the collection facility, the facility address, and the sending laboratory/hospital. Please make sure that you are completing your part. If the yellow portions are not completed, please make sure that you are reaching out to the physician or to the transplant coordinator to fill that out completely. You are not to fill out the yellow information. That is for the doctor or the coordinator to fill out. If it is incomplete, do not draw until the required fields are filled out. All donors must have a KP issued MRN. So please do not draw a donor if they do not have a KP MRN. Do not label the donor's sample with the patient information label. Please make sure that you have the right requisition for the right person. Okay, so all tests requested to be completed by the coordinator or the doctor. And as you can see in the white area, it tells you which tubes to draw and how many mLs they are going to need. So please make sure that you are drawing the correct ones. Some of them just need an ACD, some of them need a red top. So please make sure that you are going by each test because each test has a different requirement. Okay, let's just recap. If the requisition is incomplete, contact the ordering provider, care team, or care coordinator, transplant coordinator, hematology, oncology. Do not draw if the requisition form is missing required information. So the process will be review the requisition for completeness, print the KP Health Connect labels for the tubes, identify the tubes required for the collection, collect the tubes for the test requested, label the specimen tubes with the patient information, which is the KP Health Connect labels, document the collection of the blood on the requisition, make sure you are filling out all the information in that purple square, review the City of Hope requisition again for completion. Make a copy of the completed order requisition for record retention by the collecting laboratory. Package the specimen, order requisition, and non-KP Health Connect order form with specimen for City of Hope. Arrange transport for the specimen. Okay, so please make sure that you are Following those steps, please make sure if you are drawing the recipient that you are not drawing the donor and that somebody else is drawing the donor, and please make sure you are verifying all the information, the tubes required, the patient information, and the completeness of the requisition. Please make sure that you are signing the attestation form, and this concludes our HLA typing for bone marrow transplant training. Thank you.